The health sector in Uganda, health, I would say, is not one of the top priorities in the country for the general person. You've got the basic requirements of food, shelter. Health comes further down. Um, Most of the health in the country is paid for out of pocket by people or by government health centers, government-run healthcare centers. In terms of health coverage by insurance, private health insurance, less than 1% of the country has private health insurance. So most people, if they want to access healthcare, would have to go to a government facility, which is most of the time overstretched, underfunded, because again, not a lot of the budget goes into there. The private healthcare sector is the field I am in because there was a large opportunity. And again, the biggest challenge is most people pay out of pocket. So for more severe, advanced medical care, they would need to sometimes put their other things on as collateral, sell their properties to be able to afford extended health care. The biggest challenge comes due to the costs of healthcare in the private sector, is really because of the cost of capital, where you're trying to raise money for uh, new equipment, machinery, infrastructure, and the commercial loans that are available there don't necessarily give you long repayment periods or 10 years, so you're passing down the cost to the patient, and this becomes prohibitive in most cases. And again, in terms of in more general thing, I think most of the people in Uganda are um, they access healthcare at the time of need. There is no sort of thing of preventative healthcare. So with the rise of non-communicable diseases, we know the Western world or the Western illnesses that are coming in for us, diabetes, blood pressure, most of the time patients are caught with this right towards the end when things get quite bad. So that is the problem. Now, I moved to Uganda in 2012 and actually worked at the government hospital. My background is in emergency medicine. I worked at the Mulaga Hospital, which is the National Referral Hospital. And I recall when I worked in the ER department there, I used to do the day shift, turn up at 8 a.m. And most often the night doctor has already left because they were not being compensated well. So what would happen is either they've gone off to work in a private setting, and they've left patients unattended. So it was a challenge for me coming from the UK, where I worked in a nice, formal, structured healthcare system. I'm glad to say things have improved. I think the new Minister of Health and all these things that they've implemented in the government settings, so the government hospitals with a bit more funding, has improved the access. But that showed me the opportunity at that time that there is a growing middle class. Middle class, especially in the urban areas, were growing in number, and they were seeking out for affordable healthcare. Most people would fly out of the country or have their medical checkups done when they were on holiday. And I recognized that there was a need for this market. So I started off with a small healthcare center in 2013, which was really an outpatient center. And from then on, we've expanded it to a full 100-bed inpatient facility covering variety of services from outpatient to inpatient care. And we focused purely on advanced care, where we said people who are traveling out for surgery, where they could have it done locally. We started providing this advanced surgical suites, intensive care units. So the challenge still remains really is the cost, because for me to be able to return on my investment vis-a-vis the affordability of the patient, um, it's a delicate balance. So to provide the quality care at an affordable price is and will continue to remain a challenge in Uganda until we have some form of subsidies or um, cost of capital is lower, and ultimately as healthcare becomes more of a priority. And now with COVID, I feel that has, in a way, a nice opportunity for healthcare sector. Yes, it's not come in an ideal setting. We have patients who don't have access to medical care, medications. COVID, we don't know. We really don't know what to use. We follow world guidelines, and some medications are used. However, a lot of this is reliant on imports of the medication. It is reliant on guidelines to be used. So again, these are not standard. And recently, we've had challenges in oxygen supply. Again, the manufacturing sector gets subsidies for electricity subsidies to be able to manufacture the oxygen, whereas healthcare sector doesn't. So it's a requirement. We need the oxygen for our patients, but the cost of manufacturing it is prohibitive. So there is not enough supply within the country at this crisis. So I think healthcare, now that people are realizing, should be a priority, because the old age saying is that no health, no wealth. So if you don't take care of yourself, how are you going to prosper? So I feel this is a good opportunity, good time for us as a country to put health at the forefront.